Minister of Health, the Chief Medical Officer, to launch this social behavioral change strategy for family planning. Thank you very much.
Dr. Tom Sise, Director of Reproductive, Maternal and Child Health at the Ministry of Health, officially launches a new communication, social and behavioral change strategy for the NGO, Focus 1000.
We all saw what we suffered, whether it's during Ebola, whether it's during COVID, because of deep-seated beliefs that we have. Some of the traditional norms, culture, practices are good, but some are not. And I think we need to have that willingness to interrogate the way we behave, the things we do, and whether it is helpful for our health situation in Sierra Leone.
This occasion at the Bintumani Hotel in Freetown, November 26, marked a landmark development in the journey of this award-winning organization that has dedicated the last 1 decade of its existence championing the promotion of access to quality and affordable healthcare in Sierra Leone. It was part of a 3-day strategic program review by the organization.
اللهم إن كانوا محسنين فزد في حسناتهم وإن كانوا مسيئين فتجاوز عن سيئاتهم برحمتك يا أرحم الراحمين اللهم اغفر لنا وارحمنا إذا سرنا إلى ما صاروا.
Thank you because you gave us people that have gone and the great beyond. They contributed to shut an organization like this. We have reached.
Focus 1000 was established in 2012 as an NGO dedicated to advocating for maternal and child health care. At a time, Sierra Leone was battling an epidemic proportion of maternal and child mortality, among numerous other public health challenges. 12 years later, the country has seen tremendous positive improvement in many indices in the healthcare sector, thanks to high acceptance of recommended health-seeking behaviors. The NGO has been largely credited for its role in this, notably in the areas of immunization, awareness on the importance of breastfeeding, and other life-saving interventions.
One thing I like about Focus 1000 is that we are even bringing the religious perspective into social behavioral change issues. Considering that Sierra Leone is a highly religious community, and therefore, when some of these communication messages come from the pulpits or from the mosques, it's very likely that it will be well taken by our communities.
Shortly after Focus 1000 was launched, West Africa was hit by the deadliest ever outbreak of the Ebola virus disease in the world, and Sierra Leone and its Mano River Union neighbors, Guinea and Liberia, were the most affected. Thousands of lives were lost and thousands more sickened. At the height of that epidemic, Focus 1000 was instrumental in carving a response strategy that has become a model worldwide for responding to health emergencies, which is community engagement.
When we look at Ebola, there was no way we would have been able to end Ebola in Sierra Leone without the involvement of the communities. And that's again where we want to acknowledge the contribution of the Combra network, the religious leaders, the market women, the traditional healers, the civil society, the media. They were right in the center of the fight to end, Ebola in Sierra Leone. The same with COVID. So we cannot leave the communities behind. Whatever we are doing, the communities have to be in the center.
This review meeting brought together Focus 1000 staff and its partners, including the Ministry of Health, UNICEF, Irish Aid, as well as members of its grassroots community engagement arm, the Combra network, to revel on its gains and reflect on the challenges. This new communication strategy is meant to reposition the NGO with the goal of strengthening its approach for greater impact, says Mr. Jallo.
We have developed a communication strategy that defines the audience, the messages, the channels, the media, and how indicators we can use also to measure success.
A key partner of Focus 1000 in the implementation of these activities over the years is the USAID Momentum, through its affiliates, JPIGO.
USAID Momentum as we can see all on this project, is something that USAID in country supported, implementing partners led by JPIGO to really support the Ministry of Health and Sanitation to improve the quality, the access and uptake of reproductive, maternal, child health and family planning services. So that was the aim. They brought together a group of consortium members led by JPIGO. I have Save the Children colleagues here. I have Chaso colleagues. And Focus 1000 is one of the implementing partners. I start with this because we needed a strong SPC partner. And there was no other, there was no other organization in country that could do the job that we wanted for this consortium when it comes to really social behavioral change, communication, demand creation.
The review meeting also coincided with the retirement of two of the founding members of Focus 1000, Dr. Samuel Abu Pratt, Director of Programs, and Paul Senge, Director of Research. These veteran healthcare advocates were showered with a touching tribute filled with heartfelt sentiment, gratitude, and admiration for their combined over 6 decades of impact on the Sierra Leonean population.
1, 2,